The coronavirus pandemic has also become an inequality pandemic. Never before have we seen such a simultaneous increase in the gulf between the haves and the have-nots around the world. The virus has exposed, fed off, and increased existing inequalities of wealth, gender, and race. Hundreds of millions of people are being forced into poverty, while the richest, both individuals and corporations, are getting even richer thanks to soaring stock prices. The crisis has exposed the inability of our deeply unequal economy to work for all. At the same time, it's revealed the vital importance of government action to protect our health and livelihoods. This is your COVID-19 update. I'm Chelsea Delaney in Berlin. No part of the world has been untouched by COVID-19, but the effects have not been evenly shared. The world's poorest have been hit especially hard by lockdowns, school closures, and disruptions to healthcare. This next report takes us to the suburbs of Calcutta, India, where endemic poverty has worsened throughout the pandemic.
For 20 years, Tobias Vogt has been working with the aid organization German Doctors in the suburbs of Kolkata. He's saved countless lives during that time. But now COVID-19 has made life here even tougher than it already was. Masks and disinfectant are too costly for most, and it's virtually impossible to stick to coronavirus health regulations.
In the inner city areas where we work, a typical Indian family of 7 has around 10 square meters of living space. That means they already have to sleep on bunks and in shifts. If on top of that, we say, now please keep your distance from each other, it would almost be cynical to demand something like that.
Tobias Vogt knows how tough life can be for people here. In 2020, India's economic growth dropped by 23%. The coronavirus lockdown had disastrous effects. An overwhelming majority of the population are day labourers. According to a study by Action Aid, 80% lost their employment as a result of the pandemic. Here, lockdown means starvation. The situation is not that different in many Latin American and African countries. In early 2021, the international aid organization Oxfam published a study called the Inequality virus. It showed that since March 2020, the number of people living in poverty has risen from 200 million to 500 million. On top of this, 6,000 to 12,000 people die each day from starvation.
At the end of the day, many governments in the global south have been forced to make some very difficult decisions. That's because the knock-on effects of lockdowns are far more serious for people there than we in the global north can really imagine.
Additionally, any improvements made to providing access to education for children have been negated by efforts to curb the pandemic. According to UNESCO, more than 880 million children worldwide have suffered educational disruptions as a result of partial or full school closures.
Education is the key factor when it comes to helping people escape poverty. And we now see that as a result of the pandemic, as many as 33 million school-aged children are not returning to education.
Researchers like Detlef Müller-Mahn from the University of Bonn have been collecting data on coronavirus regulations in Africa. Fact is, Africa is young. People over 65, who are the most at-risk age group, make up just 4% of the population there. That's in contrast to 20 to 25% in the global north.
And this raises the question as to whether the tough coronavirus regulations may end up having far more serious consequences than the pandemic itself.
During the pandemic, agriculture and trade have suffered. Prices for staple foods have more than tripled. Farmers were not allowed to sell their goods at markets. Rural medical staff were recalled to the cities.
One observation from a project I'm involved in Ethiopia is that the government's actions have resulted in a disruption of relationships on two levels. First of all, between rural communities and neighbouring small towns, and large cities and the capital. And secondly, to a certain extent, between the rural population and state institutions.
Former German Development Minister Gerd Müller has said, quote, "Far more people will die from the consequences of the lockdowns than from the virus itself." We talked to Maria Flachtsbart, former Parliamentary State Secretary to the Federal Minister of Economic Cooperation and Development. We asked her what long-term damage could come about from the pandemic restrictions.
The worst consequence of the pandemic has clearly been hunger. Those in informal jobs don't qualify for government relief spending, nor do they have health insurance. The second direct impact is not only the effects on health from the coronavirus itself, but rather the interruption to wider vaccination distribution of all kinds. For example, to vaccination programs against measles, yellow fever, and whooping cough.
On the African continent alone, experts are predicting an additional 400,000 deaths due to malaria and HIV, along with another 500,000 deaths from tuberculosis. Although these numbers are very high, few people were paying attention to the problem of tuberculosis. The same thing is happening in India, where all the focus is on COVID-19.
When I started 20 years ago, around 500,000 people a year died from tuberculosis in India. That has slightly improved. Now about 350,000 or 400,000 people die from it annually.
These figures are on the rise again, and yet they are rarely reported on. One side effect of the global fight against COVID-19 has been that the overall global health situation is deteriorating. Tourism has also largely collapsed worldwide. 25 African countries are on the verge of national bankruptcy. Germany's foreign development minister called for a €50 billion stabilisation programme made up of European loans and emergency aid. Aid organisations like Oxfam are calling for an internationally financed global social security fund. Time is of the essence.
We need more money and more people to commit to fighting both the immediate and long-term consequences of the pandemic. Otherwise, it will come back to haunt us.
That's because the worse the situation gets, the more people will try to flee poverty and disease, leading to more migration. Without much needed aid, the Global South may be set back decades in its development. But right now, industrialized nations are busy with their own crises. The inequality virus will likely cause long-term damage around the world.
Now it's time for you to ask and us to answer. Here's a viewer question for our science correspondent, Derek Williams.
Why are vaccines still not universally available?
Many of the experts I've read tend to talk about two different aspects of this issue. The first is vaccine shortages, which are caused by factors rooted mostly in logistics. For instance, the fact that production of any medical product is going to be limited by bottlenecks in upstream feedstocks of the ingredients that go into it. It simply takes time to ramp up the entire production chain of these highly specialized vaccines to the kinds of scales that we need to fight a global pandemic. The challenges surrounding vaccine transport and distribution also contribute to shortages. But at least the vaccine shortage problem is theoretically solvable, right? I mean, we just have to get production up to speed, and we're doing that. But the same can't be said for other factors that have gotten in the way of universal availability. They're what the experts mean when they talk about vaccine inequalities. The program that was supposed to prevent them, the COVAX initiative, has struggled from the beginning to meet distribution targets for poorer countries, not only because the logistics are hard, but because wealthier countries quickly snapped up nearly all of the available stocks for their own populations. According to the WHO, vaccine manufacturers are currently churning out around 1.5 billion doses of vaccine every month. So the issue has now become a lot less about shortages and a lot more about ongoing lopsided allocation. And that's continuing, even though we know that the fastest way to end a pandemic is to make vaccines universally available.
Now, scientists are still learning about the Omicron variant of the coronavirus, but already there is evidence that it may be evading of existing vaccines. Also worrying, research indicating that important therapeutics called monoclonal antibodies might work poorly or not at all against the new variant.
Monoclonal antibodies, which are produced in bioreactors, mimic the naturally occurring antibodies made in the body after an infection with SARS-CoV-2. If given to patients while they are still in the early days of the disease, they can help mitigate the cause of COVID-19 and prevent it from progressing to a more severe stage, at least with earlier variants they did. But the latest results conclude that in the case of Omicron, 2 of the 3 monoclonal antibody treatments regularly used in the US, those manufactured by pharma giant Eli Lilly and biotech firm Regeneron, would not help prevent serious illness. In lab tests on cells, only the monoclonal antibody therapy made by GlaxoSmithKline continued to have a significant impact on Omicron's replication.
Thanks for watching.